طلاب، هذه تكملة النيوبليجيا. راح نحكي عن التيومر بروجريشن. Tumors may generate clones with different phenotypic features leading to a more aggressive nature. اللي هي example عليها تكون non-antigenic growth, having invasive يعني capability and metastasis. Rate of generation of these clones differ in individual tumors. يفرق من type to other type of tumor like osteosarcoma versus seminoma. هسه دا يشوفنا بهذا البروجرام الدايجرام عفوا التايب اوف او شلون يصير عندنا التيومر بروجريشن. بالبدايه يصير عندنا ترانسفورميشن، بعدين البروجريشن يبدي بالبروليفريشن اوف جينيتيكلي انستيبل سيل اللي هي الترانسفورم سيل، وتتحول الى التيومر سيل فاريانت، يعني تكون فاريانت اند هيتروجينيتي. هيتروجينيتي يعني مختلفه الخلايا، هي من نفس الاوريجن لكن مختلفه. فشوفوا هنا مثلا هذا الاكزامبل عندنا باللنج، هذه النورمال سيل تتحول الى سنجل تيومر سيل، بعدين يصير بها دبلنج، زين، بعدين يصير عندنا كلينيكالي ديتكتبل ماس تبدي تبين. بالبدايه تبدي ان سايتو كومبوننت، بعدين تتحول الى ديتكتبل ماس، بعدين يصير بها 10 تايم دبلنج تتحول الى لارج ماس، يعني اللي هي تكون occupying a large space of the organ، ويصير بعدين بها الميتاستاسيس. هذه هنا الدايجرام دا يشوف انه هذه النورمال سيل تتحول الى ترانسفورم سيل، وبالتالي تتحول الى التيومر سيل، والتيومر سيل ينطينا التيومر سيل فاريانتس، كل ما يصير ديفيجن ينطينا heterogenic type of cells. How does metastasis occur? How the cell metastasizes? The first step is the presence of a cell capable of undergoing the process of metastasis. اللي هي لازم يكون عندنا sustained angiogenesis and ability to invade and metastasize. الangiogenesis نقصد به هو newly formed blood vessel. زين. Angiogenic factors induce a new sprouting of vessel necessary for tumor growth, more than 1 to 2 micrometer in diameter. اللي example عليها هي الفايبروبلاست growth factor, vascular endothelial growth factor, tumor necrosis factor, platelet derived growth factor, and epithelial growth factor, and others. RAS mutation and hypoxia inducing factor promote vascular endothelial growth factor. Anti-angiogenic factor اللي هي تشمل لنا الثرومبوسبودين, angiostatin, and endostatin. P53 considered as anti-angiogenic thrombospondin. Increased vascular density mean it is a poor prognosis, a poor prognostic factor. Okay. Invasion usually occur through the extracellular matrix. بالبداية شو يصير عندنا detachment of a tumor cell. عندنا الإيلكادهرين is an intercellular adhesion molecule يصير بها inactivation بالتيومر، تصير يعني discohesive cells leading to the detachment of a tumor cell. بعدين attachment of the tumor cell to the matrix component brought about by laminin integrin receptor to the basement membrane and extracellular matrix. بعدين يصير عندنا degradation of the basement membrane by the proteolytic enzyme اللي هي metalloproteinase, type 4 collagenase, and cathepsin D. Later on there will be movement through the interstitial tissue, the tumor derived cytokines اللي هي يسموها autocrine motility factor. هو من نفس التيومر تطلع لنا cytokines. The cleavage products of matrix and the growth factor have chemotactic activity for more tumor cells. هذه شلون دا يصير عندنا الميكانيزم of metastasis. Invasion of the circulation. طبعا the tumor cell capable to invade the vascular and the lymphatic vessel. بالبداية يسوي adhesion to the endothelium، بعدين retraction of endothelium leading to the يعني permeation through the blood vessel and pass to the circulation. Attack by natural killer cells اللي هي هذه تعتبر من الاميون سيل الموجودة بالجسم. Some escape by formation of a thrombus. and escape from the circulation. يصير أيضا adhesion to the endothelium, retraction of endothelium, and escape to the tissue, to the surrounding tissue. Some tumor cells are hormone dependent for growth. This is through the presence of receptor on their surfaces. مثل عندنا البريست cancer, estrogen and progesterone dependent, thyroid cancer, thyroglobulin, prostatic cancer for the PSA. Some genes may be important in metastasis. مثل عندنا NM23 in breast cancer, KAI1 in prostatic cancer, and KIS in melanoma. هذه هي هنا يشوفنا شلون الايفنت اوف invasion and metastasis of malignant tumor. اللي هي بالبدايه يصير عندنا clonal expansion of growth and with angiogenesis طبعا. يصير عندنا detachment عفوا hydrolysis of the basement membrane, lysis of the basement membrane تعبر للsurrounding tissue. بعدين تجي على adhesion تسوي and invasion of the blood vessel تصير intravascular زين، وتنتقل عن طريق السيركوليشن الى مكان اخر. بعدين ايضا adhesion to the basement membrane وتطلع extravasation يصير بها وتبدي عندنا الميتاستاتيك سبوت او يسموها ديبوزيت. وايضا يبدي angiogenesis من جديد و growth of a tumor in a site distant from its primary origin. هذه نفس الشيء هنا دا يوضح لنا شلون يصير عندنا اللوزنينج اوف ذا ايكادهرين الموجوده بين السيلز، وبعدين يصير عندنا attachment to the extracellular matrix and to the type 4 collagen fibronectin receptors to invade the tissue. هذا هنا يصير عندنا degradation of degradation of the basement membrane، وبعدين يصير عندنا migration of the tumor cell through the autocrine motility factor اللي هي تشمل لنا some cytokines and hormones according to the type of tumor. What influences the site of metastasis? طبعا الانatomical location, complementary adhesion molecule between the tumor cell and target organ, chemoattractants liberated by target organ, protease inhibitor present in certain tissue. Example of tropism اللي هو الهومينج. شلون يصير عندنا هومينج؟ يعني مثلا البروستاتيك كارسينوما ميتاستاسيس مالتها دائما to the bone, to the vertebra, to the lumbar vertebra. lung carcinoma تروح لنا للادرينال and brain. Neuroblastoma to the liver and bone. Less common site of metastasis including the skin, muscle, thyroid, and the breast. Spleen, cartilage, heart are almost never involved by metastatic tumors. نجي هسه على موضوع الأخير اللي هو الكارسينوجينيك ايجنتس. تشمل لنا طبعا الكيميكال كارسينوجينز اللي هي دايركت كارسينوجين produce damage without barrier metabolic conversion، والاندايركت كارسينوجين اللي هي البرو كارسينوجينز تحتاج إلى conversion in the liver by cytochrome B45 dependent monooxygenase will confirm to ultimately carcinogens. Both are highly reactive electrophils, electron deficient atom, and react with electron-rich atoms of RNA, cellular proteins, and DNA. Action of chemical carcinogen طبعا هي تبدي initiation وبعدين promotion. فالinitiator تكون mutagenic chemical inducing irreversible DNA damage، والpromoter تعتبر non-mutagenic. This is augment the effect of initiator by promoting cell growth. Propyl ester اللي هو PTA activate signal transduction or growth factor secretion, hormone, secretions, and others. No tumor develop unless the promoter is applied. يعني احنا دائما اكو من يصير عندنا initiation راح تتحول الخليه يصير بها DNA damage وترانسفورميشن، لكن تحتاج الى البروموشن فور جروث. فاذا كان عندنا يعني initiation ما يتم اذا ما يكمل البروموتر. زين؟ whether it is repeated or sustained. Many carcinogens have no requirement for promoting agents. بس ما تحتاج، لأن هي نفس الانيشيتر والبروموتر موجودة في نفس الكارسينوجين. and it may share with viruses to induce neoplasia. Chemical carcinogen act by inducing RAS mutation. Some strong chemicals act as initiator and promoter مثل ما ذكرنا. Classes of chemical carcinogen, الدايركت تشمل لنا الالكيليتنج agents used in the chemotherapy of cancer may induce leukemia, while indirect pro-carcinogen active product are epoxides اللي leading to the DNA damage. تشمل لنا البوليسايكليك هيدروكربون، هذا يعتبر indirect and very strong اللي موجود بالسيجاريت smoke leading to the CA link. Aromatic amines and azodyes, this is present in the rubber and food industry. Example عليها هي البيتا نفثلامين leading to the bladder carcinoma. Nitrosamides and nitrosamines endogenous or in the preservative of food هذه بالكانز بالعلب leading to the gastric and colonic carcinoma. Aflatoxin B1, this is naturally occurring carcinogen present in the fungus اللي هو example عليه الاسبرجيلوس flavus leading to the hepatocellular carcinoma. هذا دائما يعني encountered in Africa and Far East alone or combined with HPV virus. Others including vinyl chloride, arsenic, nickel, chromium, insecticide, this is have potential carcinogens. Asbestos leading to the mesothelioma and lung cancer. هذه examples على chemical carcinogen. The factor influencing carcinogenesis including genetic susceptibility like xeroderma pigmentosa, exposure to the UV light and chemicals may lead to the development of this disease, sex and hormonal status, diet and animal foods. Physical carcinogen including ultraviolet light, this is effect depend on intensity of exposure and the quantity of melanin. A production of pyrimidine dimers in the DNA leading to the mutation in the RAS and P53. فبهالحالة ايش راح يصير عندنا؟ راح يصير عندنا failure of DNA damage repair leading to the skin carcinoma. Skin cancer including squamous cell carcinoma, basal cell carcinoma and melanoma. Other type of physical carcinogen is ionizing radiation present in the environment, like in the explosion, lead to the increased incidence of leukemia after 7 years. يعني تحتاج إلى latent period حتى تسوي لنا other type of tumor including the breast, colon, thyroid and lung cancer. أو it is a therapeutic exposure leading to the increased risk of thyroid carcinoma and leukemia. شنو الميكانيزم مالتها الايونايزنج راديشن leading to the free radical injury بالتشو يصير عندنا ميوتيشن بالراس والار بي جين and B53 gene. This is a picture of xeroderma pigmentosa. شوفوا انه السكن تكون markedly freckled, hyperpigmented, atrophied and numerous warty and nodular growth in the skin. In addition to the telangiectatic blood vessels are evident. اللي هي هذه النقاط السوداء اللي نشوفها. Viral carcinogenesis, this is a DNA viruses including a viral gene, DNA transforming gene اللي هو ال E6 وال E7 هذا موجود بال HPV inactivate suppressor genes, activate cyclines and inhibit apoptosis. The human papilloma virus عندنا low risk group و high risk group زين. فاللو ريسك جروب اللي هم عفوا اللي هي الواحد والاثنين والاربعه والسبعه هذه تسوي لنا البناين وارت. واللو ريسك جروب اللي تشمل لنا 6 و11 leading to the squamous cell papilloma genital wart اللي هي تكون low potential low malignant potential. والهاي ريسك جروب ال 16 وال 18 leading to the squamous cell carcinoma of the cervix. It acts in concert with environmental factor. Epstein-Barr virus leading to the Burkitt lymphoma, B-cell lymphoma, Hodgkin lymphoma, nasopharyngeal carcinoma, and AIDS-related lymphomas. شنو المود of action؟ إنه there is receptors on the B-cell for the viruses, leading to the activation of the B-cell and polyclonal proliferation of these B-cell under T-cell control in immunologically normal individual. This is the monoclonal proliferation of B-cell due to the deregulation of c-Myc translocation اللي هو موجود بالبركت lymphoma between the 8 and 14 chromosome. In endemic cases اللي هي الملاريا عفوا in endemic cases of malaria and malnutrition may play a role in decreasing immunity فيصير عندنا loss of T cell control. In sporadic cases, a translocation occur without the Epstein-Barr virus genome. هذا دا يشوفنا الباثوجينيسيس اوف بيركيت ليمفوما. شوفوا هنا الابشتاين بار فيروس يرتبط الى السبيسيفيك ريسبتور زين موجود على البي سيل، يسوي لنا بوليكلونال اكسبانشن اوف ذي سيل وذ انتيجينيك ابشتاين بار فيروس انتيجين موجود على السيرفيس مالتها، وبعدين يصير عندنا ميوتيشن between the chromosome 8 and 14 leading to the production of a mutant gene that leads to the abnormal proliferation of the B cell and leading to the Burkitt lymphoma. Hepatitis B virus in chronic liver disease leading to the cirrhosis. Oncogenic effect of hepatitis B virus is multifactorial. أول شيء يسوي لنا damage or regeneration or cell proliferation فيزداد الريت of mutation. هذه الميكانيزم مالته. كذلك it's encode HPX protein. This is a growth promoting gene. HPX bind to the P53, leading to the inactivation of this tumor suppressor gene, turn on of cytosolic signal transducing pathway اللي هو الراس ماب كاينيز. بالإضافة إلى ذلك, it acts in a combination with aflatoxin in endemic areas. It is not DNA virus. It is similar to the effect to the above but no X protein. يكون ما موجود به الإكس بروتين اللي هو الهيباتيتس سي. اوكي، الهيباتيتس سي يختلف عن الهيباتيتس بي انه هو not DNA virus ولكن having a similar above mechanism but it contain no X protein. A human herpes virus AIDS, this is leading to the Kaposi sarcoma in the AIDS patient. Retroviral oncogenes اللي هي ال RNA mainly in the animals except human T cell leukemia virus type 1 يكون two type acutely transforming virus transduction leading يعني the virus plus the portion of cellular gene يسوي لنا ال V oncogene أو slow transforming virus اللي هو insertional mutagenesis near a cellular oncogene اللي يسوي لنا C oncogene. RNA tumors اللي هي related to the HTLV1 induced leukemia lymphoma in human هذه in Japan. It is transmitted sexually in blood or milk. Mode of action, the target cell are CD4 T lymphocytes يعني الهيلبر which have receptor for the virus tax gene اللي هو يعتبر transforming gene leading to the proliferation with the production of interleukin 2 and the growth GM-CSF. Okay. لكن هنا ايش راح يكون هذه البوليكلونال تتحول الى monoclonal proliferation leading to the leukemia in this type of leukemia. هذا هنا بيشوفنا شلون الهيومن T lymphocyte virus type 1 attack the T cell leading to the proliferation of these cells. بعدين يصير عندنا polyclonal proliferation تصير بmutation تتحول الى monoclonal T cell leukemia. Helicobacter in carcinogenesis, first described as a cause for peptic ulcer, play a role in etiology of gastric carcinoma and gastric lymphoma. Chronic gastritis lead to the mucosal lymphoid follicles aggregation, reactive polyclonal B cell, monoclonal B cell proliferation leading to the lymphoma. While in carcinoma, this is chronic gastritis leading to the atrophy, intestinal metaplasia, dysplastic changes, and gastric carcinoma. Cancer-associated carcinogens. The CA lung usually related to the smoking, CA cervix sexually transmission of HPV virus, CA bladder to the rubber industry, CA liver aflatoxin and HPV infection, thyroid related to the CA thyroid related to the radiation, angiosarcoma of the liver to the plastic اللي هو BDC, mesothelioma related to the asbestosis. Tumor antigens, tissue or tumor specific melanocyte specific protein and tyrosinase. الفيرال HPV oncofetal هو الفا فيتو بروتين والسي الكوريو امبريونيك انتيجين. Antigens of mutated protein هي الراس والB53 والكاتينين. over expressed antigen مثل الهير2. differentiation specific antigen مثل CD10 and PSA. mucin بالبريست والكولون ovary and pancreas. هذه طبعا تعتبر immunological antigens that can be detected by immune histochemical markers. Anti-tumor host mechanism. Sensitized cytotoxic T lymphocyte. Natural killer cell may kill a tumor cell without previous sensitization. Macrophages activated by interferon gamma to secrete tumor necrosis factor alpha, which is likened to tumor cell. A humoral mechanism leading to the activation of complement system and induction of antibody-dependent cellular cytotoxicity by natural killer cells. Immune surveillance. Self-policing immune system that is supportive evidence. Patients with congenital immune deficiency have 200 times increased risk of cancer. Immunosuppressed patients have an increased rate of cancers, especially lymphoma, especially of activated B cell. How the cancer escape the immune system? By selective autogrowth of antigen-negative variants, loss or reduced expression of histocompatibility antigen, lack of co-stimulation B7-1 with MHC, immune suppression, tumor transforming growth factor beta, expression of fast ligand which send a death signal to the immune cells. High mechanism by which the tumor cell escape the immune system. What's the effect of a tumor? Mass effect by pressing on vital area. Example, airway, intestine, blood vessel, brain, nerve obstruction, infarction, paralysis, local destruction of epithelial surface or a blood vessel ulceration, bleeding, infection, functional activity in certain tumors, cancer cachexia اللي هو wasting syndrome characterized by anorexia, loss of body fat with marked weakness, anemia and fever. Possibly this is due to the release of tumor necrosis factor alpha and interleukin-1 from activated macrophages. Tumor necrosis factor inhibit lipoprotein lipase breakdown of skeletal muscle. Paraneoplastic syndrome that can't be explained by the effect of either local or distant spread of a tumor or by hormones indigenous to cell of origin. They may precede the tumor or mimic metastasis, and they occur in about 10% of malignant tumor. This may represent the earliest manifestation of an occult neoplasm. The pathogenesis of cancer cachexia, including anorexia leading to the reduced nutrient intake, reduced absorption, in addition to the abnormal loss like vomiting, diarrhea, and fistula, reduce the tissue synthesis, وهم ياخذون أصلا chemotherapy or radiation, behavioral difficulties, host tumor competition for nutrition, and abnormal tissue metabolism and tissue catabolism leading to this cancer cachexia. Paraneoplastic syndrome, this is ectopic hormone production like ACTH in small cell carcinoma of the lung, neural carcinoma, pancreatic carcinoma, ADH, parathyroid hormone like polypeptide in squamous cell carcinoma, and insulin like growth factor. Coagulative abnormalities and hematological syndromes, venous thrombosis اللي هو يسموها Trauser's phenomena, erythrocytosis, eosinophilia, thrombocytosis, non-bacterial thrombotic endocarditis, autoimmune hemolytic anemia, neurological abnormalities, skin changes مثل hypertrophic skin and muscle, hypertrophic osteoarthropathy, clapping of the finger, malabsorption in 50% of cases, and nephrotic syndrome. يعني sometimes the tumor produce a specific type of hormone or changes that produce symptom يعني similar to or caused by this product اللي هو اللي طلع لنا اياها مثلا اذا كان هرمون او changes in the blood component. Some paraneoplastic syndrome, like small cell carcinoma, producing ACTH, ADH, bone changes, nervous system disorder. Squamous cell carcinoma of the lung يسوي لنا hypercalcemia, pancreatic and lung cancer, deep vein thrombosis, breast cancer, hypercalcemia, which is more commonly produced by lytic bone metastasis and not induced in paraneoplastic syndrome. Hepatic and renal carcinoma leading to the polycythemia, pancreatic and gastric carcinoma تنطينا الكارسينويد syndrome, advanced cancer, non-bacterial thrombotic endocarditis, and colonic adenocarcinoma leading to the acanthosis nigricans. Tumor marker, this represent the biochemical indicators of the presence of a tumor. Their use are to confirm the diagnosis, determine the response to treatment, and detect early relapse. This is either present in the serum or urine, and many are present in the normal and the tumor tissue, so they are not very specific, but their level is important. Types of tumor markers هي either hormone مثل human chorionic gonadotrophin, elevated in the testicular tumor, pregnancy, gestational trophoblastic disease like hydatiformal and choriocarcinoma, calcitonin used in the diagnosis of medullary carcinoma and thyroid. Oncofetal antigen, carcinoembryonic antigen in fetal tissue, and some malignancies, colorectal carcinoma about 60 to 90%, and pancreatic carcinoma 50 to 80%, gastric carcinoma and breast cancer 25 to 50%. Alpha fetoprotein in the liver and yolk sac remnant in gonads. النورمال هو أقل من 15 microgram per liter. السيروسيس يوصل between 200 to 300 microgram. In hepatoma more than 400 microgram per liter. Both lack the specificity and sensitivity required for the early detection of cancer. Isoenzymes like prostatic acid phosphatase, increased level seen in metastatic prostatic carcinoma, useful in staging, assessment of prognosis, and response to therapy. In neuron specific enolase, increase in small cell carcinoma of the lung and the neuroblastoma. In addition to specific proteins like immunoglobulin secreted in the multiple myeloma, a prostate-specific antigen present in the epithelium of a prostatic duct, increase in the PPH prostatic carcinoma, and the level correlate with the stage. The laboratory diagnosis of cancer, including cytological examination by fine needle aspiration, brush, and fluid tapping with pap stain اللي هي يسموها البابينيكولا stain used for the diagnosis. لكن هذه carrying false positive and false negative results. Negative report don't exclude malignancy. احنا من نشوفها بالcytology suspicious, advice for or even if the case is suspicious وطلع لنا negative, advice for the biopsy اللي هو يكون more confirmative. Histopathological method, this is a biopsy from the tissue اللي هو أما needle core, endoscopic biopsy, open biopsy, frozen section اللي هو rapid technique during the operation ياخذون sample وتتحول إلى slide by specific process ويعني examined by a histopathologist using a paraffin section تحتاج إلى تقريبا 36 to 48 hour or longer for the processing. Immune histochemical or cytochemistry staining by used monoclonal antibody direct against various components in the cell may help in the diagnosis of undifferentiated cancer or help in identifying the source of metastatic tumor like cytokeratin in squamous cell carcinoma, common leukocyte antigen in the lymphoma, S100 in melanoma, PSA in prostatic cancer, estrogen receptor in breast cancer. Electron microscopy used for the recognition of desmosomes or neurosecretory granules and others. Flow cytometry by measuring the DNA content, detecting diploid versus aneuploid tumor, correlate with the rate of growth and prognosis, useful in the diagnosis of lymphoma and leukemia. Fluorescent antibodies against cell surface molecule and differentiating antigen are employed to obtain the phenotype of malignant cell. In addition to the molecular diagnosis like PCR, اللي هو polymerase chain reaction, and FISH, which is mean fluorescent in situ hybridization. The early diagnosis of cancer by specific symptoms should be followed by abnormal bleeding, change of voice, change in the anavus, abnormal lump in the breast, and ulcer that doesn't heal. A specific procedure, self-examination of the breast, mammography, serial pap smear for the cervix, serial sputum cytology in a smoker, in addition to the serial urine cytology in some cases of bilharziasis and workers in rubber. Screening for genetic mutation in familial cancer, and molecular a profiling of a tumor by DNA microarray analysis. شكراً.